Okay, how is that?
Looks great. All right. So I am thrilled to introduce Abby King, who I have known for many, many years. Our research has interests overlap. So Abby King is professor of epidemiology and population health and of medicine at the Stanford Prevention Research Center. She is a clinical psychologist by training and an internationally respected scientist and award winning teacher and mentor who has developed, evaluated, and disseminated creative solutions to major public health challenges related to prevention of chronic disease and promotion of health equity in the US and globally. She leads an interdisciplinary research team aimed at creating cutting edge behavioral and technology enabled programs promoting healthy lifestyles and environments. Her team's borderless health promotion solutions seek to create health programs that break down barriers related to education, literacy, language, and computer knowledge and access to foster health equity for all. And she'll be presenting to us today on forging pathways for leveraging the power of people and technologies in promoting health, promoting human and planetary health. So, welcome, Abby.
Thank you so much, Kim. First of all, it's delightful to see you and to also be able to share some of the things that we're working on out here at Stanford. I'm glad it's sunny out there in Connecticut. We also have a sunny day here, even though it's a little bit warmer by about 35 to 40 degrees, I think I saw. Um, so I always like to start out by just doing a quick shout out. It takes a village to do this kind of community engaged work, and this is just a quick shout out to some of our colleagues and collaborators, both in the US as well as internationally. So I have several goals today of this presentation. The first is I'm going to describe to you a citizen science method for promoting healthy lifestyles and environments. And I'm going to try to identify really what I consider to be the promise of this type of technology enabled, participatory, multi level method for really helping us to try to solve and participate in solving some of the major uh, things that are going on, the major challenges around keeping people healthy and keeping the planet healthy as well. I am also going to highlight some future directions in the field, and I'm hoping that you will write down or put in the chat any questions that you have, and we can have a discussion at the end of my conversation or my presentation. So, first, I'd like to start with a story about an older woman named Rose who has a number of risk factors for cardiovascular disease. She's pretty representative of the older population. She lives in a public housing site in a low income Northern California community. And there, she and other seniors really felt like they were surrounded by unhealthy food and physical activity environments which really made it very difficult for them to obtain things like fresh fruits and vegetables, to be able to cross the streets there safely and walk safely to the places they wanted to go, like the farmers market and the nearby senior center. So these seniors felt isolated, unconnected, disengaged, and really left out of decision making. And we know that there's plenty of evidence that disengagement and powerlessness are linked to things like worsened mental health, negative health behaviors, feelings of helplessness and hopelessness, reduce community participation, which really also prevents people from helping others. And this can be a major cause too of isolation. And we know that when people have opportunities to help others, it's linked with better mental health. So, what they really needed were changes in their local environments that could facilitate healthy eating and physical activity. And one alternative that is commonly turned to are community wide policy approaches. However, higher level environmental and policy approaches can at times be out of reach. So we know that top down policies are fantastic if we can get them in place. They can have wide impacts across a community, but they often take time, resources, and political will that really can make them less accessible to underserved communities. So, this is where participatory action based citizen science methods can come to the rescue. And I'm not talking so much about this kind of rescue that Americans are bombarded with all the time, but really when ordinary people come together to do extraordinary things. And here's one example of Perth, Australia passengers saving a trapped commuter while by working together. So, why should we think about citizen science? Well, citizen science can increase civic engagement and can help to reduce the public's mistrust of science, which currently is at an all-time high. So, what happens is that it can directly engage community members in the scientific process, which in turn can demystify science, make it more accessible and inclusive to advance health for all. So, we are very interested in promoting health equity for people and the planet. And it's useful to do this to include both top down policy levels work, as well as bottom up approaches to changing behaviors, norms, and environments and policies. So, today I'm going to talk about the bottom up way of doing this through activating residents through citizen science. So, what is citizen science? Well, it's a centuries old American tradition of engagement. And when we're talking about citizens here, we're using the traditional definition, which are inhabitants of a particular town or city without regard to legal status. So, for US adults today, the US is very generous, I think, its population oftentimes. So, you have over a quarter of people have taken part in an activity that can be broadly classified as citizen science. And these are things such as participating in data collection related to science activities, helping a child with a science project, participating in medical or clinical research, and donating funds to support medical and scientific research. So there are at least three general types of citizen science, and we define them as follows. There's for the people citizen science. This is the most um, frequent type of science and citizen science in the US and also around the world. And it involves having participants donate information and their perspectives and their biological specimens and their blood and everything else to the scientific endeavors. So, very, very important instrumental type of citizen science, but participants have things stopped at the clinic door. They do not participate farther than that typically. With the people citizen science, people become a little more involved in that they're taught how to actively collect data that can inform science. And this is very popular in biology, ecology, natural and built environments, where people are counting bikers or they're counting birds or whatever. And it's very systematic. It engages people in really important ways. But once those data are typically sent to the research group or organization, their job is done. What we like to do is by the people citizen science, which involves people from the beginning through the end of the scientific process. So they help us participate oftentimes in setting the objectives for the science. They collect and actually help to interpret their own data, and they work together to build solutions with researchers and decision makers. So I'm going to give you one example today of by the people citizen science called the Our Voice Citizen Science Research Initiative, which empowers residents to assess and advocate for healthier neighborhoods and communities with local decision makers and researchers. And the facilitators that we train in this process can be virtually anyone. They can be community organizations, researchers, government groups, businesses, or local opinion leaders or residents themselves. This type of science is based on the premise that among the most underutilized renewable resources on the planet to promote both human and planetary health are actually residents themselves. So, how does this method work? Well, it's a facilitated four-step process at its heart. And that includes first having residents discover the features that help or hinder health. Then they get together and, in a facilitated process, discuss and prioritize the most meaningful issues and feasible issues that could be changed. They then learn how to share and activate local decision makers to work with them, to partner with them, to make changes, and then actually enact those realistic changes. To do the discovery part, we use the Our Voice Discovery Tool app, which allows community members to document parts of the neighborhood or community that either promote or hinder healthy living and many, many other issues, which I will show you as part of this talk. The data are anonymized. It uses this app a mixed methods approach with geotagged photos and narratives, as well as positive and negative ratings, walking maps. It's in now 25 plus languages, and tech literacy is not needed. It's really made to be used for people of all educational and age groups across all kinds of cultures. And we've successfully used it with residents from ages 7 all the way up to 100 years old. So here's an example of a data point from the discovery tool. And so you see the photo that's geotagged on the map, and then there's the audio narrative, and the rating is the frowny red face there of whether this is helpful or harmful. And you look at the crosswalk, and the first thing we think is, oh, a crosswalk, that's a good thing. Why is this resident giving it a thumbs down with the red frowny emoji? Well, it's because if you read the narrative, you find out that this crosswalk ends in a ditch before it gets to the other side of the street. So it's actually unusable. So this is why the importance of having not just the photos, but also the stories, the narratives that go with it to better understand the lived experience of residents. So these kinds of data can be grouped across people and communities and to create maps of what we call hotspots. So here you see the green representing positive features, the red negative features, the orange a mix of positive and negative features, and the gray simply means there was a photo, but there was no rating. So these kinds of mixed methods approaches that really focus a lot on qualitative research methods are often um, a source of questions among quantitative researchers. So the questions we get a lot are things like, aren't these qualitative research methods sort of non-rigorous and squishy? Aren't they just sort of small scale? Can't they be biased when you're just looking for people's own feelings and perceptions? And aren't they hard to replicate and unreliable? Well, we strongly believe that it's incredibly important these days, in particular, to combine qualitative and quantitative methods in a lot of different kinds of science. So, for quantitative methods, things that are emphasized are objectivity, amount, and quantity. It's investigator defined and controlled. It can be reproducible. It's, the Super Bowl's coming up this Sunday. It's sort of the play by play type of action and reporting that you get is the quantitative method. The qualitative methods, meanwhile, capture the lived experience. Whoops, let me go back here. Capture the lived experience in real world context, fostering a depth of understanding that you don't get with quantitative methods, but I would call the additional color commentary that you hear in sports and football games that really bring to life the people that are involved. And so mixed methods can really help us to more fully understand, especially complex constructs, things like the social, behavioral, cultural, and environmental phenomenon that Kim and I and others really care about. So these types of mixed methods have been supported. Here you see a JAMA article from 2011 saying that both of them are needed. And they're extremely important because they combine the credibility of numbers with the emotional impact of personal narratives. And I firmly believe in having done this kind of stuff for a long time, that you need both. You need to not just touch people's brains and minds, but to touch their hearts as well. And so we try to do that in our voice through three different levers. One is the lever of science, community, and technology. We use a multi-level research model that is really aimed at what I would call a cascading effect of impacts. So it starts with the intervention, the citizen science intervention, which leads to changes in mediators. So when we get involved, people involved in citizen science, they start to build neighborhood cohesion and trust. They increase their agency and self-efficacy for being able to make changes. They connect through neighborhood social networks and all of these kinds of very important factors that can lead to change in relevant neighborhood and community structures, policies, and social activities. Those are the proximal effects. And we know from a huge amount of literature these days that those kinds of changes are associated with both individual and neighborhood level health behaviors as well as health outcomes. So this approach uses multidimensional outcome measures, as I was mentioning, qualitative measures, geospatial and visualization, quantitative assessment and mobile sensing, and observational information. So just to give you a little more information about the data collection. So the number of residents in our projects to date vary anywhere from 7 to over 240 residents, and the average size is generally around 40 citizen scientists per project. But we have been able to find important environmental changes with as few as 7 to 10 residents who can build consensus around issues in their neighborhood or community and then actually make changes in their local environments. Now, a lot of people in science, including in behavioral medicine and other kinds of fields, freak out when they see these small numbers because they immediately think, oh my God, 7 to 10 people, selection bias, how can they're not representative and all of this kind of stuff. Well, I want to point out the important difference between a lot of research we do and this type of research. So selection bias and numbers of participants is particularly critical when the major outcomes are at the individual level. So people's changes in their blood pressure, in their physical activity, and things like that at an individual level. This research, the primary outcomes are at the environmental and policy levels, not at the individual level. So it's actually very resource efficient to be able to have 7 people who can change a community infrastructure, which we've had, to make it more walkable, let's say, and easier to access healthier food for everybody in the area. Having said this, we still like to describe who our citizen scientists are, how they're recruited, and the personal impacts on their own behaviors and beliefs to help us to inform implementation processes. And just another word about a word about participant privacy and data protections, which are at a all-time high these days. Concerns about this. The data are anonymous. They're uploaded to secure Stanford server, and collective data reports are generated for the community facilitators who are usually an organization or a research group. And those people return these data to the citizen scientists. In many ways, we believe that the data are owned by the community. The discovery tool, it has a secure data repository that's been approved up through the highest levels of Stanford in terms of its privacy office, the Office of the General Counsel, and our institutional review boards. And in addition, when people engage in this kind of research with us, they themselves obtain human subjects ethics approvals to make sure that everything is copacetic with their universities and in their environments. So far, we've worked in 10 sectors and settings, including neighborhoods and communities at large, parks, which include greenways and blueways, schools, clinics, food outlets, work sites, public housing, transit, prisons, and faith-based organizations. Our voice is aimed at multiple levels of impact. So we like to see changes at individual, social and community, built environment, and policy levels. So returning to Rose and her story in Northern California, she and her fellow residents were able to, with support from my team, use the discovery tool to identify neighborhood assets and barriers to both physical activity and healthy eating. They then learned how to discuss and organize, interpret, and prioritize their data and advocate for changes. And in response, the people they were advocating to, the city planning committee and the city council, made changes and investments to enhance community infrastructure for active living. And these included things like the city created a safer walking environment through revising and repairing streets and sidewalks. They improved access to local senior centers so the seniors could actually get to their senior center. They developed a community garden with local organizations, and this was delightful for them because they really didn't quite know how to garden and cook some of the vegetables, and these local organizations were able to help them do that. They discovered that a nearby food market that was actually right across the street from the public housing setting had actually more fresh produce than originally thought. For years, there was a rumor, don't bother with that market. There's not much in there, but a lot of them hadn't really checked it out. So by walking around their neighborhood and using the discovery tool, it encouraged them to check it out. And they were pleasantly surprised to see that over the years it actually had improved and there were some good things that they wanted to purchase. And the city then appropriated new funds for an environmental analysis of the entire city to see what else could be improved. We've done citizen science in our voice with numerous kinds of populations. One of our favorite groups are college students to promote, working on various projects, some for their doctoral dissertations, others as a team, to promote local health and well-being. I have our website there, the URL there, and we would love for you all to come visit our website just to see what we're up to. So in Stanford, we've done a number of student-led projects, including things like campus gender-based violence, promoting gender equity, student mental health, plant-based food offerings on campus, and other kinds of community engagement opportunities with local schools and clinics and things around Stanford campus. There's been a lot of exciting work done in Arizona State, where students have been documenting environmental health indicators in Phoenix to share with policymakers. There's been work in Arkansas at the Colleges of Health Education where medical students were paired with local high school students to explore issues of access and equity in the local environment. And we've worked a lot with the University of Manitoba up in Canada, where they were focusing on promoting age-friendly and safe environments on campus. Those are just a few examples. We are increasing our portfolio concerning clinical environments. So we've worked in several Stanford clinics to evaluate and enhance healthcare accessibility for low-income patients with intellectual and developmental disabilities in particular. There's been a wonderful initiative that one of our colleagues in Australia successfully undertook, working with a rehabilitation center and having the patients evaluate the access and ease of being in that rehab center, where a lot of changes were then made based on what the patients were reporting. And some of our colleagues in Colorado have done a very interesting and just published project focusing on community placement of naloxone vending machines to prevent opioid overdose deaths. They worked in 3 different rural communities in Colorado which came up with 3 different kinds of decisions of where to place the vending machines based on the local residents' needs and suggestions. So one goal that we've been working on is to integrate patients' lived experience data with electronic health records to really help providers and patient groups utilize these data and really understand that people don't live in clinics. They're only patients. The patient role only is a small part of their lives for many people. Many of us have multiple roles that get in the way of our health care and our health usage. So this is one way of bringing the community into the clinic. So we've gone from local to global. We've run over 250 projects in over 31 countries now, spanning 6 continents. More than actually the US states now, it's more than 30 US states, and we have over 75 peer-reviewed publications in this field. A lot of them are listed on our website for people who are interested. And again, the major goal of this network is a dynamic exchange of data, measures, and learnings to advance global health for all. I'm just going to give you a few examples of some of the exciting projects that we've loved to partner with our colleagues. Colombia is one of our favorite countries to partner with. They're incredible. The scientists there, the residents there. One project has focused on reducing health hazards around schools with young and high school students from low-income areas to really try to reduce the hazards around the school environment. This included stagnant water, which is very dangerous for things like dengue fever and other things that run rampant in Colombia and other parts of Latin America. So they were able to get some infrastructure improvement to help to control that. The students successfully advocated for other infrastructure improvements around the school, things like traffic safety measures. They advocated for healthier food options, which they were successful in bringing into the school. And it also at the personal level, the individual level, students reported an increased sense of shared responsibility, that it wasn't just up to the principal and the administration, but that the students had to be responsible as well to make sure that the facilities and the environments weren't damaged and that, were maintained well. We've done a number of other projects in Latin America and the Caribbean, including in Cuernavaca, Mexico, where we had intergenerational groups of adults and teens helping to increase active living in their community. Cusco and Lima, Peru, where young girls who were into sports are addressing gender and health inequities through sport and physical activity, and we're able to have successful advocacy around these things that have gone all the way up to their national sport groups. We've done work in Temuco, Chile, on barriers to physical activity and quality of life among older adults living there. A similar project in Curitiba, Brazil, where we were looking with the partners there on the acceptability of the Our Voice mobile app and diverse seniors with particularly low tech and health literacy. And in fact, the seniors found the tool as practical and easy to use and quite informative. And then another project which is under review, which I think is one of the best projects so far run with Our Voice, is an experiment looking at primary school children in the island of Grenada, which is in the Caribbean, just north of Venezuela and Colombia. And here, the primary school children learn to lower mosquito-borne illness risks. We like to call the mosquitoes as the most dangerous animal in the world because the kinds of diseases that they carry that are now spreading to the US, dengue, malaria, and a number of others, are quite scary and can be quite brutal in terms of their effects. And so here, the PI, the principal investigator, ran an experiment with 53 schools across the island of Grenada, randomized them to either assessment only or to get a light touch educational program. And 10 of those intervention schools also got Our Voice. And what she found was the Our Voice schools had greater increases in knowledge, attitudes, agency, and good increases in behavior as well around mosquito-borne illness risks and how to prevent them. We've run several clinical trials. One that finished relatively recently is the Steps for Change physical activity trial funded by NCI, the Cancer Institute. And the question here was, can citizen science help increase and sustain the effects of community physical activity programs in under-resourced communities? The population were inactive older men and women living in or around senior affordable public housing sites in the San Francisco Bay Area. And we've just now are analyzing the results. Everyone got the physical activity program, but half of the housing sites were randomized to receive Our Voice, the other half to get traditional health education. And what we found is for those who received Our Voice, they were able to make a number of community changes relative to the other arm, including things like sidewalk repairs, barrier removal so people could walk on walking paths, new crosswalks and stop signs, improved bus stop signage and schedules so the seniors could actually start using public transit, and a greater focus on green spaces. And looking at the physical activity changes, we're finding that there are greater walking minute increases in the Our Voice arm relative to the health education control arm. So just to summarize some of the successes so far of Our Voice that have been demonstrated, infrastructure repair and additions, more greenery and gardens, healthier school environments and safer routes to schools, increased access to healthy foods, more age-friendly community events and groups, safer indoor clinical environments, safer activity supportive parks and recreational spaces, and increases in personal and collective agency, efficacy, and connectedness among the people participating. And we know from the literature that these types of environmental changes have been linked to better mental health and well being, decreased loneliness and isolation, feelings of empowerment and trust, increased self and collective agency, enhanced social connectedness and civic engagement, and improved capacity to participate in future community actions, what we call ripple effects. We're doing continual iterations thanks to our incredible students and postdoctoral fellows at Stanford and elsewhere on the Our Voice method. The latest model now has 7 um, parts to it, steps. One of them, the Imagine step, is new, number 4, which I'll talk about a little bit, and also making sure that the engagement steps and the sharing steps are also strong. So our goals continue to be things like building an online interactive global movement of citizen science data and results for use by all, linking microscale lived experience data with other data platforms and ecosystems falling in the big data category, and doing things like testing generative AI and virtual reality in this space. I'm going to give you a taste of each of these. So here we've had our wonderful doctoral students in my epi department and population health department looking at ways to integrate the lived experience, Our Voice mobile app data with big data. So here we see the big data was the US National Walkability Index, which you can find by zip code in almost every place in the US. And they wanted to link that with the Our Voice data in those zip codes. So we had 4 zip codes that had similar walkability indices scores, but we found that even though they were very similar on that big data variable, there was much greater variability when you looked at the percentage of local features that residents were rating as barriers to walkability. So the variability was from 19% to 55% of what they were rating were barriers. So it suggested just because on a big data level, things may seem similar. In fact, when you get down to the micro scale lived experience, they really are not. We've also combined quantitative and mobile sensing data with Our Voice for greater knowledge gains and insights. This was run by one of my postdoctoral fellows, Ben Kissinger, who is now a faculty member at Tufts. And he used a wrist-worn sensor of electrodermal and heart rate activity and had policymakers who wanted to see what was going on in San Francisco areas to try to figure out how building and policies should be handled. He had them walk around with a discovery tool wearing this Empodica device. And they were able to locate places along these various walking routes that were linked with increased arousal and stress that the policymakers themselves weren't that aware of. We've also used cutting edge technologies to help people imagine change, to enhance engagement and connections and impact. And I'm going to show you a few things. One is in the immersive technologies field of augmented and virtual reality. The other is generative AI, where the focus is on creating new content by learning from existing data. So first, let's start with virtual reality. Again, our colleagues in Colombia ran an incredible study in Bogota, Colombia, focused on unpaid caregivers. These are women who are unpaid, caring for a lot of the disabled relatives and family and neighbors in their areas, and they have to get them to places, and it's very dangerous for them to walk their care recipients to places or try to get them to places for care and other things. And so these local caregivers learned how to immerse the stakeholders, the decision makers who could do something about these conditions in the specific dangerous locations through virtual reality goggles. So they were able to capture through VR goggles their routes to trying to get these patients to their healthcare appointments or to even to shop in the grocery store. And they paired this, we helped them pair this with listening to the participants' own audios of their perceptions. And what we loved about this is that these low income, less educated, mostly women caregivers learned very quickly how to use this VR system and were able to train the policymakers themselves to better understand what they were seeing. And what we found at the end of the day is that both the policymakers and the caregivers rated the virtual reality as easy to use. It could enhance this our voice method. It could facilitate the dialogue between the citizen scientists and policymakers and could help create innovative solutions. As one policymaker said, virtual reality really takes you to the place, and the audio helps us to live the experience of the caregivers. And another policymaker noted that virtual reality allowed them to understand the perspectives of the people that live there. And there it became clear there were many factors that needed to be improved. We also have an incredible colleague now at Florida State University who did his doctoral work in Colombia, up in Cartagena, which is borders the Caribbean. And he's been done incredible work with generative AI and other things in the El Pochon area of Cartagena, which is a settlement there, an informal settlement that is among the most impoverished part of Colombia. So he had youth citizen scientists identify barriers within their environment using the discovery tool and then help them envision innovative solutions by leveraging tools such as GPTs and Photoshop AI to help them imagine a realistic solution to the barriers they were noting. So, for instance, one huge barrier in many countries in Latin America is poor waste disposal, which can be a vector for mosquito eggs and other things and lead to all kinds of illness. And so they were able to use AI generatively to come up with a solution that actually would work in the El Poson area. They did the same thing with standing water, which is a huge vector for dengue and other kinds of mosquito-borne illness. And after iterating with AI, they were able to come up with a solution that was feasible, cost-effective, and could work. So the students then learned how to engage relevant stakeholders by presenting their AI-enhanced ideas and were able to activate this group of stakeholders to help them further refine and implement the proposed solution. So here is a before after picture. So they were able to use their data, the citizen scientists, to spark action. So these were, and I had the honor of visiting this school in September, and the students are incredible, these high school students, and they were telling me how the water was so bad there. And of course, it rains a lot. It's the Caribbean, it rains all the time. And the muddy streets got so bad that some of these high school students could not walk to school. They couldn't make it to school because the mud was almost up to their knees. And so they were able to work with the local decision makers through their data and get the kind of um, surfaces, as you can see here, that were needed. So here, I love this photo because it shows not only can now people walk to school, but kids can, for the first time, bike again on roads and paths there. They also worked on a local park that had deteriorated and was often unusable. The high school citizen scientists were able to bring their data to local decision makers and to actually get more accessible exercise equipment, low cost but useful exercise equipment in their park. And they're still going. They continue to use AI to develop more ideas on turning the park into a sport and exercise friendly place, which we're very excited to see. So, this is the gift that keeps on giving, and we call it ripple effects. And we see it in almost every Our Voice project that's ever been run around the world, where once people get empowered and learn how to use these tools, they apply them in all kinds of areas. So here's an example here in San Mateo County, right here in the Bay Area. There was a small project working on food access and low-income seniors paid for by San Mateo County. We had citizen scientists capture their food access. These were low income, very diverse groups of seniors. And after they did that, they were able to learn how to improve their local food environments. The project was 3 months long, and then it officially ended. Well, the citizen scientists didn't end, because then we heard at 9 months after the project that they had taken those skills, those empowerment and activation skills, and used them to improve a dangerous street segment in front of some of the housing sites there. Then we learned at 12 months that they advocated for affordable senior housing, and at 24 months addressed speeding drivers. So our question is, what's next? It's the gift that keeps on giving. What else are they going to do? I'm near my time to finish here. I just want to note there's actually a formal, systematic mapping method called the ripple effects mapping method that we can share with people if they're interested. It can capture immediate and longer term effects on things like awareness of resources, increasing health behaviors, improving outcomes, overcoming challenges, increasing social connectedness, and enacting community and policy changes. So it adds additional information after projects have finished. We're working in mental health areas, in violence prevention. We currently have a collaboration with the Human Rights Center, the UC Berkeley School of Law, for instance, to capture and help improve the working conditions at refugee camps in Bangladesh, some of the largest refugee camps in the world. And this project was initiated by the young people living in those camps who felt like there were improvements that could be made, that they really wanted to be able to collect data on. So we would love to hear any ideas you might have for our voice projects. And we find it's important to work with people that have a passion around a specific community issue, local commitment to fostering health equity and giving everyone a voice. It's important to have a community organization or opinion leader group who can help, boots on the ground sorts of things, and help coordinate with researchers this kind of research. So some future directions have to do with intergenerational groups harnessing their power and social networks and technology, looking for opportunities to partner with public and private sector organizations as well as other types of organizations, and employing culturally informed technologies to reach all groups. Another area which I'm particularly interested in is combining health behaviors as complementary and synergistic targets to promote population-wide behavioral health and to tackle health and environmental challenges both from the top down through policy change, as well as from the bottom up, where we can also get policy change, but it's being driven through the residents themselves. So, in summary, I think and community engaged citizen science is a promising pathway for fostering personal, community, and planetary health so that we can all contribute it to growing the vision of a world of vital and thriving communities for all. So I'm going to end there. And you see our website here, ourvoice.stanford.edu. And I'm delighted to hopefully be able to take questions and have any kind of conversation with you all. Thanks very much.
Thank you very much. This was really interesting. I knew a little bit about your work, but I had, no sense of the scope of it. So really done some amazing, amazing work. I definitely have some questions, but I see that we have someone who raised their hand. So Mark Litt, did you want to start us off?
I did. Thank you, Abby. That was an incredible presentation. I do have one practical question is how did you recruit your citizen scientists?
Yeah, that's a great question. Oftentimes, the recruitment comes about organically because we have researchers and community organizations coming to us. So they'll either find us on the website or they'll hear a presentation like this one by some of my team members or they'll read about us in an article and they'll reach out to us. And on our website, there's actually a place where people who are interested in learning more about what we do and whether it could be relevant reach out and note to us what they are. So it's the community organizations that have the shared passion, commitment, and are working often in a particular area that they know is really important for their community who reach out to us. They oftentimes are well connected with their residents, so they can easily get some residents together. And again, it doesn't have to be very many residents. It can be 7 or 8 residents in a particular area who care about their senior center or they care about the violence in their neighborhood or whatever it is. Generally, it is that community organization or research group, a community facing research group who is already working in a community. They see an issue and they want to add our voice to see if that will help to enhance their outcomes. So oftentimes I think that's a great use of our voice, which is to piggyback it onto other interventions that are maybe more individually focused that are already going on with our research colleagues. Mark, did that answer your question?
Yes, thanks. That did.
So I'll jump in with a question. I'm keeping an eye on the chat and the hands up, but hopefully I'm not missing anybody. So Abby, I was wondering if you could tell us if someone wanted to collaborate with you. I know that they could, go on your website and reach out, but is there a cost involved to using the platform?
Yeah, so the way we work it, and like medical schools all across the US, we are self-funded, and obviously we're a nonprofit group, the way Stanford and most universities around the US are. But we need to cover at least some of our costs through a variety of ways, and I do it partly through my endowed chair that I have, partly through grants that we write, and then through a portfolio of organizations also coming up with some funds to help to support the work they're interested in doing with us. So usually we start by having people do a taste test for free, try out the discovery tool, see how it works, see how it might be useful for a particular research study or project. Then we oftentimes work with them to do a small pilot at usually reasonably low cost, where they try out the whole process and get their feet wet with it. And then we usually collaborate with them in writing grants and ways to cover a larger project. So we do it in sort of a staged way. We do it on a sliding scale, obviously, for someone going for an NIH grant. We want a reasonable amount being written in if our voice is going to be one of their intervention tools. For doctoral students who maybe just have a small bit of funding through something that they have or something, we'll work with them as well. So, the goal is to try to meet the needs of anybody who would like to, who has a problem or issue they're working on that really has an environmental or contextual piece to it that's very important, because that's what our voice really focuses on, is the contextual parts of an issue, the local environments, social, physical environments. So it's negotiable, I guess.
Okay.
Is what I'm
Great.
saying,
Great.
Kim. The
Yes.
long and the short of it, it's
Yeah.
academia, and we negotiate everything to try to make realistic, decisions so we can partner with as many people as want to do it.
Yeah. I have one other question. I don't see anybody else's hand. I don't want to hog the mic, but I don't see any other hands raised. So I was wondering more about the policy component. So do you, and you may have said this and I may have missed it, so I apologize if I did, but do you actually have like built into your platform the ability to like reach directly out to people's like local representatives, or and then like the training piece about policy? So like how
Yes.
does that part work?
Yeah, great question, Kim. It's a really important part of that four-step model. So the way it works is the organization we're working with identifies a citizen scientist. We train them or help to train ourselves, the citizen scientists, in using the discovery tool to collect the local data that's relevant to the issue at hand that the community wants to focus on. Those data then are discussed by the citizen scientists in a facilitated process, and either the community organization can facilitate it if they're comfortable. If not, we can do it remotely, or we can train community people on how to facilitate a discussion with the citizen scientists where they identify the high priority, significant, meaningful changes that they think could happen, and we focus a lot on feasibility. So we're not going to build a bridge over a freeway, but we could help the community figure out how to add stop signs or crosswalks to a local area. Then, as part of that discussion, the citizens and the community organizations and the research groups involved brainstorm what decision makers in their local community could deal with it. So, for instance, in one of the communities, trash was terrible in this low income community. All of the affluent neighborhoods were using the low income neighborhood as a dumping ground for extra old mattresses and refrigerators. They didn't want to take it to the dump, so they dumped it into this Latino community, this neighborhood. And so the neighborhood, of course, said, gee, we need to talk with the garbage collection people. What can we do about it? And so the third step is to invite those decision makers, and the citizen scientists learn how to do this. They invite the decision makers to come to this second meeting where the citizen scientists present their results, and the right decision makers are there around garbage, around sewage, whatever the issue, the park and recs department, whatever the issues are, those are the decision makers and that can do something, that are invited. And the great thing about this Latino community, they invited 7 different decision makers, and all 7 showed up, and they were all bilingual because they're serving this Latino community here. And they immediately told the people about the dumping, hey, we will pick this up for free. This is part of your service. Here is the number, the phone number to call. So oftentimes there's very simple, low cost solutions that are available. And so they work together. And sometimes we've had students, fifth graders, presenting to school boards on their data and what needs to change, and to their city councils on what needs to change. And those groups are sitting in the place where they can make changes, and they do. Because how can you not respond to fifth graders up there with the microphone showing you how dangerous this intersection is, and this is where
Yeah.
our teacher was killed. So it's incredibly inspiring, and what we find, Kim, is that the researchers and the decision makers get as inspired and empowered as the residents do. Everyone can
Amazing.
buy into it.
Yeah. Great. Well, I see we're at time, so some people were able to stay on, but some folks had to jump off. So I just wanted to thank you again so much, and I'm sure you'll be hearing from some folks at UConn about potential collaborations because it's extremely exciting work, and I hope to see you soon. Thank
That
you
sounds
again.
great. Thanks, everybody. Stay
Uh,
warm.
yes, thank you.
Bye.
Bye.